Standardized cost means relevant agencies estimating and agreeing the average cost for key budget items. Child protection coordinators should be able to explain the benefit of standardized case management costs, understand their role in fundraising and advocacy using standardized costs and budgets, calculate average staffing costs, identify other key items to include in standardized case management budgets. Child protection services often demand greater and more expensive human resources because services rely on specialized capacities and skills. For case management, the cost per child requires one-to-one tailored actions and repeated follow-up in order to respond adequately to imminent threats and mitigate future risks. Standardized costs can significantly help to ensure sufficient staffing to ensure quality support to children and families in line with the minimum standards for child protection in humanitarian action, support effective advocacy with donors to adequately fund the child protection response, and facilitate joint fundraising efforts. Coordinators have primary responsibility for leading on the identification of case management funding gaps in terms of both quality and coverage, and facilitating discussion on standardized resources and costs together with member agencies. The Global Protection Cluster recommends standardizing costs through a consultative process. If there is a case management task force, the leads and members should support coordinators by facilitating the process of identifying approximate costs for case management. There are 4 types of budget items to include. Staffing costs, for example, caseworkers, supervisors, activity costs, for example, case management office space, filing cabinets, emergency case funds, etc. A percentage of support costs like HR, finance, logistics, and a percentage of indirect costs or overheads. Agreeing standardized costs can be challenging, especially when it comes to staff costs. Coordinators and partners should work together to estimate the total caseload, calculate the number of caseworkers required, identify the number of supervisors required, and discuss and agree on appropriate salary ranges for caseworkers and supervisors. Coordinators also should work collaboratively with partners to identify solutions to overcome other challenges to standardized costing, such as different locations have different prices for items, all cases are managed differently, and how to estimate indirect costs, such as community engagement and relationship building, can be hard to quantify. Developing standardized costs for child protection case management requires patience, collaboration, and compromise, but it is critical for ensuring quality programming, adequate funding to support children's protection and well-being.